Hi, my name is Sheryl Hoolsema, and I'm the director of EPIC, which is Empath and Partners in Care here in Pinellas County. So I've been working here in Pinellas County for the past 25 years with hospice services and individuals who have HIV or have been diagnosed with AIDS. I started back in 1995 working here in the community when really there wasn't a lot of services for those who had HIV or an AIDS diagnosis. And I think most importantly, when I started working, seeing the difference between services and what was available at that time versus what's available now is very important to the community. We have a lot of services that are available now, including case management services, which is one of the major services that EPIC does provide here in the community. A lot of times clients aren't aware of where they can go to for services. They don't know that things are available to them, and so when they do get that initial diagnosis, there's a lot of concern, fear, stigma about agencies or places that will be willing to help them, especially if they're uninsured. So in the past, where HIV was people really felt like it was a death sentence. That's definitely not what we're seeing now. And we know that if we can get a client on medications and keep them on medications through linkage to care, then their life expectancy is no different than someone who is not HIV positive or has never had an AIDS diagnosis. For care, when we look at defining care, especially linkage to care within the HIV community, it's getting people linked into medical services, medication services, so that could be their own primary care physician, that could be Pinellas Care Clinic, which is an option for Ryan White clients here in the community, and then linking them into ADAP or other pharmaceutical arenas, whether it's CVS or a pharmacy linked to their case management agency. We have Uber Health to be able to transport them to their provider's office, whether that's their doctor's office, mental health counselor, pharmacy services. Once we've linked them to care, we're looking at an overall community-based approach then, and allowing the clients to really become part of their own health care, but with that assistance of the case manager. Ultimately, the goal is to keep them healthy, which will in turn keep the community healthy. So once we can do that and we can lower a client's viral load, we can increase their T-cell counts with the use of medication, and we can keep them in care, it lowers the chance of them infecting others within the community. So, we talk about in outreach, prevention, and condoms and everything, but we know that's not 100% all the time. But if we can say to someone your viral load is 0 or undetectable, they lower the chances of infecting other people should they be engaging in unsafe sex. So while we do want to see people using condoms and engaging in that healthy sex practices, we do know that lowering someone's viral load has an overall impact on the community, and then we're looking at a much healthier community, not just our clients. So overall, getting clients into care, keeping them in care is important, not just for that clients, but for our community as a whole. I'm passionate about the work I do because I think that it really, at the end of the day, getting people into care and linking them to care is really the ideal piece of what we do, and making sure that they can live a life that's full and engaging and really just everything that it should be, regardless of an HIV diagnosis. We do have wonderful medications now. We didn't have those back in the 90s. And I know that people can live a long, healthy life with HIV if they're on medications. And I think it's just super important to be on medication. I've seen too many people die from something that is completely treatable at this point. And I think that just knowing your diagnosis is obviously the first piece, but then getting on treatment and staying on treatment is really important to the longevity of people's life and being out in the community and having the life that they're meant to have regardless of an HIV diagnosis. In one word, ending the HIV epidemic would mean to me community.